this class, I'll be mainly emphasizing on how a wound after forming is healed, and type of wound will also be discussed in this class. So what is wound healing? One second. Okay. So wound healing, a wound is a break in the integrated skin or tissue, which may be associated with the destruction of structure and function. We know this definition. So a formation of wound, it can happen anywhere in the body, in the external surface or in the internal body. Wound can happen anywhere, and it might lead to structural deformity or even functional deformities. And in this class, we'll be emphasizing on how a wound is healed after it's formed. So in this wound healing, our body will attempt to restore the integrity of the injured part. So we know that an injury or a wound can happen anywhere in the body, anywhere within or outside the body. But what decide the regenerative capacity of the wound? We know that if the wound is in the skin, it can regenerate quite easily. Whereas if a nerve is affected, regeneration won't happen quickly or it won't happen at all. So what decide whether wound is capable of regeneration? So on the basis of the capability to regenerate, we can broadly categorize tissues into three: labile tissue, stable tissue, and permanent tissue. So labile tissues are the tissues within our body which has got regenerative capacity. So they can regenerate quickly after a wound is formed. And next comes stable tissue. Stable tissue can regenerate, but not as quickly as a labile tissue. Whereas there are permanent tissues in the body which are not at all capable of restoration. We look into these three. First, if we look at labile tissue, I've given a few examples, right? Skin is one of the labile tissues. Then connective tissues are there. Small and large intestines are there. So one thing that we can see in common in these three tissue groups are, they have one thing in common, and that is nothing but stem cell. I hope all of you have heard about stem cell. So stem cell is something like groups of cell that helps in regeneration, right? So stem cells are present in skin, in connective tissue, in small intestine, large intestine, and all. And the presence of these stem cell give them the possibility to regenerate even after like big wounds or like that. Whereas stable tissues are not having stem cells within them. But what happens after an injury? If you look at liver, we can see liver is one of the examples for labile tissue. So imagine like liver, a portion of liver has been like damaged or something. And what happens here is it doesn't regenerate like skin or like connective tissue. What happens here is mature liver cells will try to differentiate or divide. So we can see hyperplasia of mature liver cell. So imagine a tissue of liver, it has been damaged, and how is that damage recovered? What happens here is that the normally existing liver cells will start to divide. They'll divide, and due to hyperplasia, we can see that liver cells will eventually start to regenerate. Eventually, the liver cell regeneration will happen. So that's the difference between labile skin like skin and stable cell like liver. In skin, we can see a new skin tissue, skin cell will be formed from stem cell. Whereas in case of liver, a new liver cell won't be formed. What happens is it will start to regenerate from a pre-existing mature cell. So that's the difference between a labile and a stable cell. Whereas there is another category. The third category of cells or tissues are permanent tissues. So the examples I've given are skeletal muscle, cardiac tissue, neurons, and even cartilage. So we know that once a neuron is damaged, the regeneration is almost impossible. And that is because they don't have stem cells within them, or even mature cells are not capable of differentiating or division. So what happens here is that scarring will happen. We'll imagine heart tissue is damaged due to some other reason. We say, for example, MI happened and blood supply was poor, and an area of that area of heart got some kind of injury or a wound, and how it is healed, how that area is healed. Only scarring can happen. But what's the problem here? Once a normal heart tissue is injured and scarring has happened, it's not capable of doing any normal functions. So that's the difference between labile, stable, and permanent tissue. Labile tissues like skin that can regenerate, quite quickly, whereas stable cells like liver, it can regenerate, but only by hyperplasia. So at least some amount of liver cells should be there. That's the difference here. And the third category, the permanent tissues, they're not capable of regeneration because they don't have stem cells within them. So the only way in which they can compensate the tissue losses by fibrosis or scarring. So that's the difference between these three categories of tissues in the body. I hope that is clear. Next, we'll move to phases of wound healing. So wound healing, we all know mainly there are three or four stages: inflammatory phase, proliferative phase, remodeling phase, or maturing phase. But before this stage of inflammation, mostly hemostatic phase can be seen. Before inflammatory phase, we can mostly see hemostatic phase. So if you refer different textbook, some textbook says it's 3, some says it's 4. So if there are 4, the first one they have considered hemostatic phase as a different phase. So that's why there will be 4. I mean, that's how 4 stages will be there. So we'll look into the 4 stages. We'll look what happens in a hemostatic phase of wound healing. We say that once a wound is formed, what's the first thing that will happen? Say, for example, a skin tissue got like a cut happened, and the first thing that will happen is bleeding. So profuse bleeding will happen from that site, and the first thing that our body will attempt to do is to stop that bleeding somehow. So that's the stage of hemostasis. So in order to prevent the blood loss, a clot is formed at the site of injury. So in this portion, we'll see how after an injury, our body tries to form a clot. So mainly 3 things happen. A platelet will be formed, then fibrin meshwork will be formed, and this blood vessel in the affected area will start to constrict. So we can compare this with a highway. Okay, so imagine all the vehicles are smoothly going in a highway, and imagine a big gutter is there. So what will happen is that imagine the first vehicle stopped there, and all the vehicles are somehow stopped here and there. A chaos is happening. So we can compare a wound to that kind of a chaos. So what happens is that in the blood vessel, we know that platelets are freely flowing, and suddenly when a wound happens, the platelets flowing in that area will start to adhere to one another. So that's nothing but platelet plug formation. So the first thing that we can see that the platelet in the surrounding area will get clubbed, or it will get adhered to one another, and that will form a plug, and that's nothing but a platelet plug. So that's the first thing that we can see after a wound is formed. So here our body is somehow trying to control the bleeding. So bleeding has already started, and the platelet in the vessel and blood vessel will somehow start to adhere, and they'll form a clot. After this platelet plug formation, next thing that we can see, a net-like structure is formed in this area, and that's nothing but a protein. So a protein network forms around these platelets. So first we have seen a platelet plug forming. In this, you can see these are the platelets, and here the platelets which were freely flowing through the vessel, suddenly after this cut is or a wound is formed, they'll start to club with one another. We can see all the platelets clubbing to one another, and after that, these networks, this mesh you can see right, and that's nothing but a protein called fibrin. A fibrin meshwork is formed, and why it is formed? It is to reinforce the platelet plug. So here we can see a platelet plug, and platelet plug will be surrounded by this meshwork of protein. And in addition to these two things, the blood vessel through which this platelet was forming, it will somehow try to constrict, so that this blood flow will be stopped. So this hemostasis is the first phase of wound healing. I hope these 3 steps are clear. So first, the platelets flowing through that vessel will will adhere to one another, which forms a plug. And then at the same time, protein meshwork called fibrin meshwork will form in that area, and that will reinforce the plug that has already formed. And finally, we can see the blood vessels of that area will get affected, and they'll somehow try to constrict. And this constrict, that's somehow this that our body is trying to prevent the blood loss here. This is the first stage of wound healing. The bleeding is followed by vasoconstriction and thrombus formation to limit blood loss. Platelet adhere to the damaged endothelial lining of the vessel, releasing ADP. ADP, we know ADP is adenosine diphosphate. ADP will be released, and that will also help in this aggregation. This aggregation of this network of protein and platelet will be reinforced by by ADP secreted by platelet also. Here we can see tiny platelets. Platelets will secrete that already adhere to that area will secrete ADP also. The secretion of ADP will also help for a compact packing of that area. So, as we have seen, immediately after a wound is formed, our body has somehow formed a clot here. So if we look into this image, we can see platelets here. That dot structures are nothing but platelets. So platelets is formed, and this thread-like things are nothing but fibrin. So here we have seen fibrin and platelet. And down we can see the blood vessel also. I hope that's clear. So that blood vessel will try to constrict. So this is the first phase, first thing that happens after a wound is formed. That is hemostasis. Shall I move to the next one? So here the next step is stage of inflammation. So you know, once we get a wound on skin or somewhere, after a few days, within a couple of days, inflammation will happen. All the signs of inflammation, rubor, dolor, calor, everything will eventually happen, right? So how does inflammation happen once a wound is formed? This stage of inflammation is also called as substrate phase, exudative phase, or lag phase. These terms just keep in mind. Maybe we can ask these in MCQs. So the inflammatory phase begins immediately after wound and lasts for a couple of days. For 2 to 3 days, this stage will last. When bleeding stops, the platelet then release several cytokines and chemokines. So I hope you have heard of cytokines and chemokines. They're nothing but proteins. So this platelet, in addition to this platelet secrete cytokines and chemokines. We have already seen two functions of platelet. Here in the inflammatory phase, platelets secrete cytokines and chemokines. So some examples for cytokines and chemokines are platelet-derived growth factor, then platelet factor 4, then TGF-beta, transforming growth factor beta, then epidermal growth factor. Such things these proteins will be secreted by the platelet of that area. So these things that they lead to inflammation of the area. So it's like we compared this wound with gut, right? Imagine it was a smoothly going highway. A gutter was there. A few vehicles were coming, and all the vehicles had to stop. And again, vehicles kept on coming, and it's a big chaos. Imagine it's a big chaos. So what happens is that let's just imagine that a few passengers called cops, and these cops are coming because they had to remove the gutter, or they have to remove the vehicles from the site. Maybe an accident happens. So if we imagine like that, we can see that the platelets here, they release cytokines and chemokines, and they in turn activate phagocytosis here, because we have somehow remove the bacteria and the debris from the area, right? So this thing is happening only because of the presence of macrophages in them. So the release of chemokines and cytokines stimulate neutrophil migration and then activation of macrophages, lymphocyte, which eventually lead to phagocytosis, wound debridement, and matrix activation and angiogenesis. Because after a wound is formed and the blood flow has somehow stopped, there are much more things to be done in that area. We can see that the tissue loss is there. So in that area, tissue has to reform. Then maybe some debris will be trapped in the area. The debris has to be somehow removed. Imagine a few bacteria is also coming to that area from the environment. So everything has to be cleared properly, and new tissues has to proliferate also, right? So in order to activate all the events, platelets release cytokines and chemokines. So the release of cytokines and chemokines by the platelet stimulate neutrophil migration, then macrophage activation and lymphocyte activation. And that leads to all the events like phagocytosis, wound debridement, matrix activation, and angiogenesis. Here we can see one injured cell. Imagine this is an injured cell and the injured area, and there's a platelet in that. Platelet lead to the secretion of chemokines and cytokines. Cytokines and chemokines in turn lead to the activation of these cells. Platelets and the locked injured tissue release vasoactive amines also. So we know vasoactive amines, which are they? We know that they are histamines, serotonins, and prostaglandins. Main three are these, and these vasoactive amines increases the vascular permeability, and eventually all the inflammatory cells will infiltrate into this area. The macrophages coming to this region will remove all the devitalized tissue and all the extra microorganisms that has come from outside. So this is the second stage. That's the stage of inflammation. So here we can see the platelet plug. We can see in the dark blue color. They have activated. They have released all the cytokines and chemokines, and they in turn release all the Hello. Hello.
Yes, doctor.
Okay. So here we can see the macrophages and neutrophils infiltrating the area along with monocytes coming to the area. So this is how the second stage or the stage of inflammation will happen in wound healing. So here, if we look at the periphery of this image, we can see bacteria from the periphery coming to this area. So how was our body tackling the outside bacteria? We can see neutrophil going, and neutrophils will help to remove all the bacteria from outside. Okay, so we can see all the tissues working together. Vasoactive amines will be coming. So what's happening here? We can see all the signs of inflammation also happening in this area. Next is the third phase is proliferative phase. So already blood that is easily flowing has checked, and second stage inflammation also has happened as a protective method by the body. Third, we have to next thing that the body has to do is to proliferate the cells so that tissue loss will be compensated. So here we can see the proliferative phase lasts from third day to third week. These days are important because these are usually asked as questions. So proliferative phase lasts from third day to third week. In this step, the basal cell proliferate and replace damaged or lost cell. This step consists mainly of fibroblast activity with the production of collagen and ground substance, the growth of new blood vessels, and the re-epithelialization of the wound surface. So these are the things that has to happen. The collagen that is already collagen is the kind of the structural collagen gives the structural support to the tissue. So collagen will be produced. Then ground substance matrix will be produced. Then new blood vessels has to be produced, right? So angiogenesis will happen, and finally the epithelium that has lost in that area will also be compensated or regenerated in the wound surface. So all these four events will happen in the proliferative phase. So we know one more important question is regarding vitamin C. So vitamin C is very important for the repair of a wound. And what is vitamin C's role? Vitamin C helps to produce collagen. So fibroblast needs vitamin C to produce collagen. This is an important statement. Just remember the importance of vitamin C in wound healing, because fibroblast needs vitamin C to produce collagen. The wound tissue formed in the early part of this phase is called granulation tissue. We'll in detail learn about granulation tissue in the in the section of ulcers. So in the later part of this phase, there's an increase in the tensile strength of the wound due to increased collagen, which consists mainly of type 3 collagen. This proliferative phase with its increase of collagen, collagen deposition is associated with wound contraction, which can considerably reduce the surface area of the wound over the first 3 weeks of healing. The wound has to contract, because usually we know when a wound is formed, it kind of expands, right? So we have seen when a wound heals, that area after the scab is formed try to contract. The last phase is the phase of remodeling. Remodeling usually begins at 6 weeks, and that can lead up to 2 years. Depending on the site of the wound and type of the wound, it may lead up to 1 to 2 years. Usually, it starts with 6 weeks and ends with within 6 months. The remodeling phase is characterized by maturation of collagen. So, collagen maturation is also one important question usually. Type 1 tissues is replaced by type 3 until the ratio is 4:1. So in our body, type 1 tissues, like the ratio of type 1 to type 3 tissue is usually 4:1. So normally, when a wound is formed in the phase, during the phase of wound healing, type 3 collagens are produced. But at the remodeling phase, the type 3 collagens, which is already produced, will eventually get converted into type 1. So in a normal body, we can see a ratio of 4:1 of type 1 to type 3 collagen. And in a wound healing, type 3 collagens are more. So as the remodeling phase goes on, type 3 will gradually get converted into type 1 until the ratio is achieved. There's a realignment of the collagen fibers, decreased wound vascularity and wound contraction due to fibroblast and myofibroblast activity. So one more important thing that we should remember is activity of fibroblast and myofibroblast during remodeling phase. So remodeling phase, one thing, this ratio we have to remember, type 1 to type 2. We have to also remember about fibroblast and myofibroblast activity. Maturation of the collagen lead to increased tensile strength in the wound, which is maximal at the 12th week post-injury and represent approximately 80% of the uninjured cell. Uninjured skin. So in the remodeling phase, we can see how the remodeling has happened, and almost similar tissue has been replaced. So I hope you remember how the initial hemostasis phase was there. That entire area has been replaced with new cells. To the epidermis, we can see a little elevation in this area, and that is a new epidermis that has formed in the area. So we'll once more go to the 4 stages: hemostasis, inflammation, proliferation, remodeling. Some textbook gives only inflammation, proliferation, and remodeling phase, but we can, because they include hemostasis as a part of inflammatory stage. But here I have kept us 4 different stages for a better understanding. In the first hemostatic phase, body tries to form a clot, and that clot is formed by the help of platelet plugs and fibrin threads. So that's the first thing that is happening to the body. In addition, the blood vessel in the surrounding area will also constrict. In the second phase of inflammation, we can see platelets releasing chemokines and cytokines, which eventually will signal the production of macrophages and neutrophils. So all this debris, scab tissue, external microorganism, everything is removed. And the third phase of proliferation, we can see all the cells proliferating. So here, I hope you can see the connectivity of the blood vessel is lost. Blood vessel is seen only in the right and the left ends of this photo. But in the third photo, you can see how body tries to reconnect the blood supply of the 2 parts. Angiogenesis is almost starting in the proliferative phase. Here, mainly fibroblast and myofibroblast works for the proliferation of the tissue. In the fourth photo, we can see how the body has restored, tried to almost give a similar image to the skin. Up to the level of epidermis, all these layers of skin has remodeled here. Even the blood supply has completely re-established, and we can see all the cells has been properly re-established. The structural regeneration has completely happened in the remodeling phase. These are the 4 steps of wound healing. Once a wound is formed, body has to go through all these 4 stages in the body. But it will vary from different tissue to tissue. But in general, we can say these are the 4 steps of wound healing. Now we'll see type of wound healing. I'm sure everybody knows about primary healing, secondary healing, and tertiary healing. So what is primary healing? Primary healing It occurs in a clean incised wound or surgical wound. So primary healing will happen only in cases of incised wounds or surgical wounds. Wound edges are approximated with sutures. There is more epithelial regeneration than fibrosis. Wound heals rapidly with complete closure, and scar will be linear and smooth. Here, if you look at the photo, you can see in the first one that's small. Imagine this is just a cut. A small cut has formed, and they have tried to suture it. So once the suturing has completed, the both edges has come together. So after these edges are brought together, it's so easy for the body to regenerate all the tissues. So here, after the wound is completely healed, we can see a simple fine scar can be seen. And this fine scarring will eventually disappear. The scar will eventually disappear. Here, the one condition for primary healing is that the wound edges should be approximated either with suture, or if the wound is so tiny, it will happen naturally. Imagine a small abrasion has happened, it will definitely heal by primary intention, first intention. Here, one thing that we have to keep in mind is that fibrosis will be so minimal because body is so, easily capable of doing restoring the tissue with epithelial regeneration itself. Complete closure of the area will also happen. So secondary healing is exactly opposite to first intention healing. Here, if the tissue loss is so much and the tissues cannot be brought together, definitely this area will be healing by fibrosis, and that's secondary healing. It occurs in wound with extensive soft tissue loss like major trauma, burn, or wounds with sepsis. So it heals very slowly with maximum fibrosis. In the first intention healing, we saw that fibrosis is so minimal. Epithelialization is very common, but in the secondary healing, epithelialization is not enough for complete healing. Fibrosis has to be there in order for a complete healing. It often leads to white scar because the shape is somewhat like in the next image we can see hypertrophied and contracted. May lead to disability. Reepithelialization from remaining dermal elements or wound margins. So here we can see here this wound is little bigger than the first wound, and suturing is not done. Wound edges are not brought together. So only thing that can happen is a scar tissue will come, and the scar tissue will compensate. That area it will be permanent scar. That's how second intention wound healing can happen. But one more wound healing is there. One more possibility is there. That's a combination of the first and the second one. That's nothing but the third intention healing. So this third intention healing, one example that we can give I'll give examples for primary and secondary healing. Primary healing, simple examples we can maybe a small cut or a surgical incised wound. Everything can heal by first intention. Whereas secondary healing example can be tooth extraction. Imagine a tooth has been extracted, and that area heals by fibrosis, and it will take time, and that is second intention healing. Whereas third intention healing, one example will help to remember third intention healing. That is dog bite. Imagine a dog bite has happened. So how do we manage a dog bite? We don't do suturing or anything. What we do is we'll clean that area regularly without closing without bringing the edges of the wound together. Wound debridement will be done to control the local infection. Wound is closed with suture or covered using a skin graft. So here we can see wound is left open for a considerable time, and it's daily cleaned. It's regularly cleaned to prevent all infection, and we observe it. We observe the wound for a time, and if needed, after proper observation, we'll if required, we'll do skin grafting. If skin grafting is done, of course, primary intention healing will be done, or gradually this wound will heal by secondary intention. So wound is there, granulation tissues will form gradually, and late suturing with white scar. If we have to do late suturing only, and we can see a scar. Why is it done like this? Because if we do the suturing immediately after the wound is formed, there is high chance of bacteria or debris getting trapped inside the wound, and later it will lead to secondary complications. So in wounds like this, wounds like dog bite, we have to keep the wound for quite some days in order to make sure that there is no bacteria or debris trapped inside. So in such cases, we'll keep the wound open for a number of days, and eventually we'll clean and the granulation tissue will form on its own, and it will heal by secondary intention, or by skin grafting, primary intention wound healing will happen. So these are the three ways in which wound healing can happen. First intention, secondary intention, and tertiary intention. So this is the important topic of today's class: how wound is healed, and what are the types of wound healing: primary, secondary, and tertiary intention. Now we'll see types of wounds, because I'm not stressing on this aspect, because already in forensic medicine, this area will be covered. This classification is tidy wound versus untidy wound. Tidy wound, we know there are wounds like surgical incisions and wound caused by sharp. They'll be incised, clean, healthy wound without any tissue loss. Healing is definitely by primary intention. I hope that's clear. And the second classification is untidy wound. There are a lot of examples for untidy wound. Crushing, it can occur from crushing, tearing, avulsion, devitalized injury, vascular injury, or multiple irregular wound, or even burn. And wound infection, dehiscence, delayed healing are common. We know it's quite easy for us to understand untidy wound, because we know the tissue loss is much more when compared with the tidy wound. Liberal excision of devitalized tissue and allowing to heal by secondary intention is the management. Secondary suturing, skin graft, or flap may be needed, as we discussed earlier. Here, a secondary suturing may require, skin graft or flap may be needed. So classification is done by rank and Wakefield classification. So remember this name. Tidy and untidy wound is so easy for us to remember, but who did this classification? It was rank and Wakefield classification. So this is one classification: tidy and untidy wound. Then this second classification we have learned in forensic medicine, classification based on the type of wound. So incised or clean wound, we know it's a tidy, simple cut wound with linear cuttage, usually due to sharp object like blade, glass piece, or knife, and it's treated by primary suturing. Lacerated wound also, we know it has ragged edges with some part of the tissue getting devitalized. We know in lacerated wounds, the tissue loss will be much more than a normal simple wound. Viability of the tissue may be impaired depending on the area where the tissue has lost and how much tissue loss is there. Viability of the tissue may be impaired. The depth of injury and tissue damage should be carefully assessed. Proper adequate wound excision through warm saline wash and suturing of the wound layer by layer is required. This is how a lacerated wound will look like. The next is bruise or contusion. So I wanted to stress on the difference between bruise and hematoma. So first we'll see what a bruise is. Bruise or contusion. It's due to blow or blunt force to the skin and tissue underneath, wherein blood vessels or capillaries are damaged. Then there is skin discoloration without breaking of the skin. Broken vessel cause seepage of blood underneath. Minor soft tissue injury crushes small vessels without breaking the skin, accumulating and trapped blood will be present underneath. There's more on the skin over the bones. Lax area like face, scrotum, eyes, vascular areas. Then children, old age people, and it is very common in people with fair skin. This is how a bruise will look like. The next is hematoma. Hematoma is a localized collection of blood after blunt trauma or after surgery. Collection of fluid blood in a few minutes to hours get clotted. Later, eventually, it gets liquefied and shows discolored fluid. It may be subcutaneous, intramuscular, intrafacial, or intraarticular. So here I want to emphasize on the difference between a bruise and a hematoma, because that could be a question. So here the difference is that a bruise will always be from a it's the cause what's the cause of bruise, and it will be always from a tiny blood vessel. It will be from a small blood vessel, and that area will be very smooth and it will be tender to touch. So the bleeding is usually from a very small blood vessel. The area will be flat and tenderness also will be there. Whereas in case of a hematoma, there will be pooling of blood because the blood is usually coming from a large blood vessel. And the area where the hematoma is present will be usually raised, and it will be very painful to touch. It will be very painful. I hope you know the difference between tenderness and pain. So hematoma will be painful. It will be always, patient will complain of pain, whereas bruise will be usually tender to touch. And hematoma requires draining. Abrasion, we know, it's a very superficial injury due to shearing of the skin where the surface has rubbed off. Then the tangential force causes loss of epidermis, and dermal vessels and nerves will be exposed, and that will lead to profuse painful oozing. Then abrasion heals by epithelialization. This is abrasion. This is crush injury. We know crush injury, it's due to major wound, like war wound, natural disasters, and even tourniquet injuries can also lead to crush injury. And crush injury may lead to compartment syndrome, muscle ischemia, loss of tissue, gangrene, and sepsis. Muscle will loses viability, which is identified by its color. A dark color with loss of shining. That's how a crush injury is differentiated. Loss of contractility, then the area will be turgid and it will not bleed on cutting. This is how a crush injury will look like. Then gunshot injury. This will be the last injury I'll be discussing about. I didn't go through in detail about these injuries because you'll be learning in detail in forensic medicine. So gunshot injury, we know there will be an entry wound usually followed by an exit wound. Then it causes explosive and destructive injuries along with burn injuries in the deeper planes and organs. It can be high velocity injuries with massive bleeding and major organ injuries. So usually this is how it will look like. So that's all regarding today's class. Do you have any doubt